Hi, my name is Kelsey Berkner. This is my final physical assessment for Intro to Health Assessment class. I'm going to begin this assessment by performing hand hygiene. Hi, my name is Kelsey. I'm going to be your nurse tonight.
Hi.
Can you tell me your name?
Stephanie.
Hi, Stephanie.
Hi.
So before this video was taken, we took Stephanie's vitals. Her vitals were, blood pressure was 121/84, heart rate was 73, pulse ox was 100% on room air. She was breathing 16 times a minute, and she was afebrile at 97.9 temperature. Her height is 5'4", she weighs 174 pounds, so her body mass index is 29, which is normal, not over or underweight, so that's good. So we're going to begin this assessment just getting a good overview look at Stephanie. Facial expression is appropriate for situation. She appears to be well groomed. So I'm going to look at her skin overall. Can I see? I'm going to look at your legs. Just going to pull up your pants, look at the skin down here. I'm looking for any varicose veins, superficial veins. I do not see any. Skin pigmentation is even over the entire body area. Skin is warm to touch and dry. Skin is elastic. It returns immediately back to its original position after I pull it up. There's no bruising, no lesions or nodules noted. I'm going to come up here and inspect the scalp. I am palpating for any nodules or lesions. There are none noted. The scalp is dry and clean. The hair is clean. Hair is distributed evenly over the scalp. There are no deficits noted here. I'm going to take a look at your nails. The nails have an appropriate shape and color for, she has her nails painted, but they have an appropriate shape. They are trimmed, they are clean, and no deficits on either hand with her nails. Her head is midline, it is symmetrical. All of her facial features are symmetrical. I am going to palpate the temporal arteries. Okay, and pulses are +2 and equal bilaterally. I'm going to auscultate the temporal arteries for any roots. And there are no roots noted on either side. Now I'm going to palpate the lymph nodes. I'm going to start with pre-auricular lymph nodes, post-auricular, retropharyngeal, submandibular, submental, superficial cervical chain, the deep cervical chain, and supraclavicular. And no lymph nodes were palpable on either side, so that's good.
Okay.
What I'm going to do now is assess to see if there are any abnormalities with the temporomandibular joint. So I'm going to place my hands here and ask you to open your mouth a few times and close it. Perfect. All right, one more time. That's great. Did you feel any discomfort or pain there? Great. And there was no crackling sounds noted, so there's no abnormalities with that. Now we're going to assess your neck range of motion. So if you can look up at the ceiling, perfect. Put your chin to your chest. Great. Now put your left ear to your left shoulder and right ear to right shoulder. Perfect. Any pain or discomfort with that? No. Okay, and movements were smooth, full range of motion, no deficits there. So that's great. I'm going to palpate your carotid pulse, one side at a time. And I'm going to auscultate for roots. here. Could you hold your breath for me? Okay, you can breathe. And there are no roots noted. I'm going to come to this side. Hold your breath for me. And there are no roots noted on that side. I am going to palpate the trachea. The trachea is midline. I'm going to ask you to swallow for me. Okay, I can feel the thyroid rise when you swallow, which is perfect. The thyroid is midline. I'm going to auscultate it and listen for any roots. And there are none noted. Now I'm going to go on to your facial features. So I'm going to start by your eyes. The eyes are symmetrical. They're both the same color, both blue. Conjunctiva are clear. Sclera is white. No drainage noted. No redness or irritation noted. I'm going to have you look just look at my eyes. I'm going to shine this light in your eyes, okay? Pupils bilaterally are 4 millimeters. They are equal. They react to light and go down to about 2 millimeters and then go back to 4. So they are equal and reactive to light. We're going to test accommodation now. So I'm going to have you look at that picture on the wall. Now look at my finger. Look at that picture on the wall. Look at my finger. All right, perfect. And they accommodate appropriately as well, bilaterally. So that is testing oculomotor, which is the cranial nerve number 3. Oculomotor, no deficits there. We're also going to test cranial nerves 4 and 6, which are trochlear and abducens, by doing the cardinal fields of gaze. Okay. So just follow this pen line with your eyes. Okay, and that tests the ocular motor as well. So now we're going to move on to test the optic nerve, which is the second cranial nerve. And there were no deficits there with that, and no nystagmus noted. Your eyes moved perfectly and evenly, bilaterally. Okay. So now we're going to test the optic nerve. So just read this, hold it about 12 to 18 inches away.
Okay. Understanding the essentials of critical care nursing.
Okay, great. Now we're going to test your distance vision. If you will have it stand up for me and just stand in the line that we drew for you. And I'm going to have you read the smallest line that you can on the Snellen chart, but cover one eye first.
Okay. E, D, F, C, Z, P.
Perfect. Now you can open that eye and cover the other eye and read the smallest line you can.
E, D, F, C, Z, P.
Perfect. Okay. So you have equal vision in both eyes. One eye is not weaker than the other, and both of your eyes are 20/30 on the Snellen chart, which is good.
Okay.
While you're standing up, I'm going to assess your spine. I'm just going to feel. And can you bend over for me and touch your toes? Okay, you can come back up. Curvature is normal and appropriate. Back is symmetrical. No scoliosis or kyphosis noted, so that's great. You can have a seat. Now we're going to have a look at your nose. The nose is midline. I'm going to palpate for any nodules, none noted. No tenderness there. Okay, great. I'm going to have you occlude one of your ears. Breathing normally. Okay, great. Occlude the other one. Can you breathe normally through that one? Okay, great. No distress noted with that. So that's good. Both of them are patent. I'm going to have you close your eyes now. Occlude one of your NURS like you just did. And tell me what you smell.
Fruit smell.
Okay, that's correct. And occlude the other NUR. And tell me what you smell.
Fruit.
Okay, this is fruit scented hand sanitizer, so that is an appropriate response. I'm now going to palpate the maxillary sinuses. Any pain or tenderness here?
Mm-hmm.
Okay, perfect. No tenderness noted bilaterally. Any tenderness here?
Mm-hmm.
And no tenderness on the frontal sinus, so that's great. Now I'm going to have a look in your ears.
Okay.
No drainage or debris noted in the ear canal on either side. I'm now going to palpate for any lesions or nodules. There are none noted on the tragus or auricle. The patient is wearing earrings. And now I'm going to assess the mouth. The mouth is symmetrical. Can you smile? Perfect. Teeth are clean. Can you open your mouth? Mucous membranes are pink and moist. Tongue is pink and moist. Airway is intact. No occlusions or deformities there. So that's great. Now what we are going to do is I am going to listen to your lungs. Actually, first I'm going to do a breast assessment with you.
Okay.
Do you do a self-breast exam at home?
Yes.
Okay, great. We're going to do one here, and then I'm going to have you give me a return demonstration.
Okay.
So lift your head behind your neck. Perfect. So I'm just going to palpate for any lymph nodes or nodules. I'm going to start in the axilla and then work my way around. Feeling for any lumps, and then work your way from the outside into the inside. I didn't feel any lumps or abnormalities. Can you show me a return demonstration?
I'll start from the axilla and then just work my way from the outside into the center.
Perfect. That's correct. And you would do the same thing. You can put your arm down. You would do the same thing on the other side as well.
Okay.
And it is best to do that monthly, of course, and the week after your period is when it's preferred.
Okay.
So now I'm going to do a lung assessment, and the chest is symmetrical, chest rise is symmetrical, respiratory rate is even and non-labored. Okay, bilateral lungs are clear anteriorly. Now I'm going to listen over here on your side laterally. Okay. Okay. Both lateral sides sound clear. If you could lean up for me, I'm going to listen back here. And lung sounds, posterior lung sounds bilaterally sounded clear as well. So all lung fields are clear, which is good. Now I'm going to do the cardiac assessment. I'm going to listen to your heart sounds. I'm going to start by in the aortic area, which is the second intercostal space right of the sternal border. I'm going to move to the second intercostal space left of the sternal border, which is the pulmonic area. I'm going to move to the third intercostal space left of the sternal border, which is Erb's point. Now I'm going to go to the fourth intercostal space left of the sternal border, which is the tricuspid. And now I'm going to go to the fifth intercostal space left of the midclavicular line, which is the mitral. Okay. And S1 and S2 sounds were noted, which is perfect. No murmurs were noted. I'm going to go back over those same areas with the bell of my stethoscope and assess for any extra heart sounds like S3 or any roots. I'm just going over those same areas. And no abnormal sounds were heard there. So that's great. Now I'm going to check your peripheral pulses. We've already done temporal and carotid. So I'm going to feel for your brachial pulses. Brachial pulses are +2 and even and regular bilaterally. I'm going to check for radial. Radial pulses are +2, equal and regular bilaterally. I'm now going to check for popliteal pulses. And popliteal pulses are +2 as well, bilaterally. Going to come down here and feel for posterior arterial pulses. Those are +2 bilaterally, and dorsalis pedis pulses. And those are +2 bilaterally. So that's great. I'm gonna go back down to your legs and assess for any edema. So I'm gonna pull your socks off. Okay. And there is no edema noted in either lower extremity. I'm going to check the capillary refill of your hands. Capillary refill is brisk bilaterally, less than 3 seconds, so that's great. That's what we want. Now I'm going to do the cranial nerve assessment. We've already done cranial nerves 1, which was the olfactory, 2, which was the optic, 3, which was the oculomotor, 4, which was the trochlear, and 6, which was the abducens. So now we're going to start with 5 here. I'm going to ask you to close your eyes. Whenever you feel something touch your face, say now, okay?
No. No. No.
Okay, you can open your eyes. Those responses were appropriate. So there's no deficits with your trigeminal nerve, so that's great. Now we're going to do cranial nerve number 7, which is the facial nerve. So I'm going to ask you to smile. Perfect. Puff out your cheeks. Perfect. Can you raise your eyebrows? Great. And can you frown? Great. Facial movement was symmetric. There was no drooping. Everything moved equally, so that's great. Facial nerve is intact, no deficits. Now we're going to do cranial nerve number 8, which is the acoustic nerve. I'm going to whisper a phrase in each ear. Tell me what you hear me say, okay?
Okay. The sky is blue.
Okay, great.
The grass is green.
Okay, perfect. Those are both of the phrases that I said, so there's no hearing loss noted in either ear. Hearing is the same bilaterally, which is great. Okay. So now we're gonna do, we're gonna assess cranial nerve number 9, which is glossopharyngeal. So I'm going to ask you to, if I can find my pen line. I'm gonna ask you to open your mouth and say ah. Perfect. The uvula is midline and moves up appropriately like it's supposed to when you say that. So that nerve is great as well.
Okay.
Now we are going to assess cranial nerve number 10, which is the vagus nerve. So can you swallow this water for me? We're assessing swallowing here. Great, and you swallow without difficulty?
Yes.
So that's perfect.